We have had our second positive presumptive case of COVID-19 here in the state of Hawaii. An elderly resident of Oahu traveled to the state of Washington. He started to feel ill on March 2nd. He returned to Hawaii on March 4th and went immediately to an urgent care facility because he wasn't feeling well. He checked into a hospital on March 7th, where a sample was taken because of his travel history to the state of Washington. And we confirmed the positive for COVID-19 this morning. So we are working with the CDC and federal agencies to get more information about this case. As you all know, we definitely will be working through his specific travels and contacts that he may have had. We will be identifying who they are and reaching out to inform them that they have had contact with someone who is positive or presumptive positive for COVID-19. And then the State Department of Health would be working through that continuing investigation and ensuring that we contact all of those who may have had any exposure.
Our staff at the department are working very hard to try and determine if there are any other potential close contacts to this individual. From the history we have thus far, we're confident there are very few in terms of the direct contacts in the state of Hawaii. However, our focus, as well as the CDC's focus, is on those who may have traveled on board the vessel that the person was on, as well as unfortunately also the persons that this individual may have been exposed to while in the state of Washington, because as has been said, illness onset was during this, the time in the state of Washington. So we are at this moment actually dialoguing with our Washington state colleagues to convey to them whatever information we can get to them to help their investigations in the state of Washington.
The timeline, the March 4th when he returned, I mean, he's already symptomatic. He doesn't go to the hospital until March 7th. So we have a 3-day gap here, correct? You know what?
This is a very ill individual, and from we understand of the story, basically stayed at home in bed and until the ambulance was called.
The individual arrived on the 4th. They went to an urgent care center there at Kaiser and went home after that. Presumably was at home throughout the next few days until the ambulance was called, and he was then taken to the hospital. The ambulance personnel are all trained on dealing with individuals with respiratory disease, and would have taken precautions in getting him to the hospital. And of course, he's in the hospital in isolation now, so there's no risk to anyone in the hospital. The hospital, of course, has elaborate procedures for isolating an individual as this one is, and he remains there in apparently serious condition.